About, I believe it was about 8 years ago. My son was probably around 4 years old. He had been seeing a pediatric ophthalmologist since he was 6 years old, or 6 months old, for a condition called exotropia, which is essentially his eyes weren't tracking, but had never really required treatment other than monitoring. My husband and I were 4 or 5 days late one month paying our health insurance premium, and the insurance company terminated our policy, which I understand. But when we called them and went back and asked them to reinstate us, they refused to reinstate my son to our family policy because of his pre-existing condition.
Apply to all of the insurance companies that provide coverage in the state of Illinois, including AARP, and found that because of my preconditions, I was continuously getting rejected. The frightening part was that I myself am extremely healthy and work out and very conscious of it, but my preconditions are all factors of heredity. My mother, who has osteoporosis and a thyroid condition, high cholesterol, all put me at risk, and therefore none of the insurance companies wish to insure me.
In addition to that, some of the things that plagued her was that she had pre-existing conditions that when she went to get service for the, lung cancer that she developed, that there was those things that they weren't willing to do because she had these precondition services.
Every so often, maybe every 5 years, I reapply for insurance. And one time, I applied with Blue Cross Blue Shield. They turned me down because I had marriage counseling. That was considered a bad thing for health insurance. It wasn't anything I was going to go on with. But they turned me down, and I had to find another carrier.
As a self-employed person and others who probably could afford to pay standard health insurance, we cannot even get it. Because if you have been diagnosed with, let's say, high blood pressure, you've had gout, or some other incidents, the insurance companies, oh, no, we don't want you. Or your height and weight don't fit our standards.
I see patients that are unwilling to be admitted to the hospital because they don't want to be labeled with a particular diagnosis for fear that they may be labeled with a pre-existing condition and not be able to get health insurance down the line, or maybe dropped from their current policy. These are huge barriers for patients, and what I see is overall people struggling more and more to find adequate health care in a way that makes them feel safe and secure.